Hi, I'm Kath from Maltracking and Physiotherapy, and today I wanted to do a knee taping. So taping for the knee can often help when you've had an injury to the knee, offloading the structures around the knee, and also give increased input to the muscles around the knee and help them work better. So I'm going to use 4 pieces of tape, 2 short pieces and 2 longer pieces. It's very useful to round the edges of the tape because that helps the tape stay in place, as well as aesthetically looking better. Okay, so just rounding the edges of my long pieces of tape. Make sure that the skin is very clean before you start, and that will help the tape to stick to the skin. So for the first piece of tape, you're looking for the base of the kneecap. The tape is quite forgiving and you don't need to be in exactly the right place. You want to tear the tape and fold it back. Avoid touching the tape. Find that inferior part of the kneecap, come underneath it, putting a bit of stretch on the tape, and then making a smiley face with the tape underneath the knee. We're going to reinforce that with another piece of tape. So again, you want to tear the tape, put a stretch on the tape, a little bit underneath the previous piece, reinforce it, stretch, lay on the ends. Always lay on the ends of the tape. That prevents the tape tugging up the skin and irritating the skin and keeps the tape in place. So for my longer piece of tape, I'm tearing the tape at the end and I'm going to come round the inside of the knee. So I'm laying the tape on the end, and then I'm stretching the tape around the inside of the knee and then laying it over those quadriceps at the top there. Reinforcing again with the second piece of tape. Coming underneath the knee, no stretch, and then coming around the edge and then laying on at the top. So to start with, the tape isn't very sticky, so you need to be careful placing clothes on top of the tape, but within a couple of hours it becomes really sticky and then it'll stay in place for up to 4 days. When you take the tape off, be kind to the skin and peel it off very gently, because we don't want the skin to be traumatized, because then we won't be able to put the tape on until it's recovered. So have a go at that. The first time it can be a bit tricky, but once you get the hang of it, it's an easy tape to do yourself.